Next, I get to introduce one of my favorite people in the whole world. Dawicki is a physician's assistant with us at Plymouth Bay Orthopedic Associates. She has great energy. I love working with her. I love working with her patients. She comes to us after some time spent at Children's Hospital, so she has a really interesting take on sort of the adolescent part of sports injuries, and in particular concussion. So this should be a really nice talk. I'm going to turn it over. Erin.
So I'm going to talk about what a concussion program is, and hopefully what our goals at Plymouth Bay Orthopedics are in implementing that. So as Dave mentioned, the four of us are all certified in post-concussion treatment, and we're really trying to become the premier location on the South Shore, and even the South Coast for that matter, to provide concussion care right from the time of injury all the way back to return to play. So what is a concussion program? So this is a program designed to treat all the sequelae of a concussion from the acute phase, so within 24 to 48 hours from injury, all the way through to the full recovery. As Brett mentioned, this is a multidisciplinary program and involves many people from many different specialties. So this includes the primary care providers, the CIC, which is what Brett and I are, which is a certified impact consultant, physical therapy, occupational therapy, speech language pathologists, and psychologists. The goal of a concussion program should be accessible, meaning the location is easy to get to, is close off the highway, ease of obtaining appointments urgently. So again, within 24 to 48 hours, we ideally want to see those kids for their initial evaluation. And it should be a resource for schools, the athletic community, and community programs. So the treatment team consists of a credentialed impact consultant. That can be an MD, a DO, a PA, or an NP who has completed specialized training and certification. So the impact program in particular is 7.5 hours of continuing medical education, and there's an exam at the end of it. It's a timed exam, which I didn't realize before I started the exam. So if anyone does this, make sure to do it in a quiet space without your 3-year-old running around you. And you must complete specialized continuing education yearly to maintain your certification. So when you log onto the impact program, this is my login page right here. And you can see that my course status is completed right over here, meaning I've taken the test and been certified. And then over here, you can see the topics that they cover in the educational component. So this includes concussion, clinical trajectories, impact, raw data, and the composite scores. So those are the scores that we interpret for the patient to help give them a trajectory for their recovery. The clinical report interpretation and treatment options, advanced clinical report interpretation, the pediatric raw data and clinical report, quick test interpretation, and how to create a concussion clinic. Once you pass that certification exam, you come up on this website, which is concussioncareproviders.com. And as Dave mentioned, we are the only program in the entire state of Massachusetts that currently has both the pediatric bar as well as the physical therapy bar, and we're considered one of their featured providers. You can put in any zip code and it will show any providers within your predetermined radius. So what does a CIC actually do? So after a concussion, a CIC will evaluate your symptoms and your cognitive function using the FDA-approved impact computerized test. They've actually just changed the test so you can do this at home. So we can actually email patients a link to take before they get here. That's only approved for over age 12. So the pediatric patients still need to come in and do this on an iPad. And each concussion patient is different. So having a trained healthcare provider educate you about your symptoms and prescribe safe activity levels has been shown to decrease the overall length of your symptoms. We'll also make appropriate referrals to other healthcare providers on the team to help manage care. So physical therapy for us is our first go-to, and Maddie's going to talk a lot more about that, so I'm going to kind of gloss over that part. But again, early appropriate levels of physical therapy are now recognized as an extremely important component of treatment. And this cartoon kind of spoke to me because at least 10 years ago, it was thought complete rest, dark space, wake your kid up every hour was the appropriate thing to do after a concussion. And now we know that that prolongs the length of symptoms. Occupational therapists are also an important part of the treatment team. So they can help patients analyze their daily tasks and strategize ways to manage and accommodate daily symptoms so that they can avoid exacerbations. So an example is developing school accommodation plans or return to work strategies. They can often work as liaisons between the school and workplaces to develop a return to learn and return to work plans. Speech therapy, so speech language pathologists, the cognitive and communication impairments after traumatic brain injury or a concussion can include deficits in speech, language, social communication, information processing, attention, memory, swallowing. And it's also common to have deficits in executive functioning skills, such as planning and organizing. Speech-language pathologists can be an extremely important part of the post-recovery team. So neuropsychologists typically are used for patients who have lingering or post-concussive syndrome. And they will assess the patient's background and comorbidities to look for contributing factors. For example, that could be medication injury, so medications patients were on before their concussion can contribute to the length of their symptoms afterwards. History of sleep disturbances, prior concussion history or traumatic brain injury history, and history of depression and anxiety can also contribute to prolonged symptoms. They can offer cognitive behavioral therapy and cognitive rehab and coping strategies. So the school systems in the administration are also an important part of the team and unrecognized. They're critical partners in transitioning kids back to their learning environment. Open communication with the school nurses and support staff should ensure that appropriate plans are implemented to accommodate the patient's recovery. They can assist in developing educational plans and goals as the patient progresses, and provide support and ability for the patient to rest if their symptoms are exacerbated. So sometimes kids think that they can go back a bit sooner than they're quite ready for, and they might find out that the loud noises and the crazy environment in the school hallways actually exacerbates their symptoms. So having the ability to go to the nurse's office and just sit for a half hour may be useful. The athletic departments, so the Massachusetts Interscholastic Athletic Association does require concussion training and education for any student athletes and involved adults. Athletic directors and the athletic trainers are the vital link between the student athletes and accessing care. And developing the community relationships between the schools and the concussion programs can speed the access to care after injury. So for example, Dave has done an amazing job reaching out to our local athletic directors and giving them direct access. So I believe they have a special number that they can call, and they will get Dave or Maddie and be able to get an appointment with us within that 24 hours. So community programs, so this is kind of something we're hoping for the future. But ideally, a concussion program will provide a place in the community where kids can come in and they can do their summer baseline testing. This is currently done routinely for high school students, but a lot of our local football programs and hockey programs are looking for a home for their students to do this testing. Community education and providing lectures like right here for concussion awareness is also important. So the challenges in accessing care is awareness in the community of who can benefit from specialized concussion care. A lot of the primary care providers in the area have received some level of training, are now trying to manage those patients in-house. So if we can be the spot where they know to send their patients to, I think that will help patients in speeding their recovery. Adult patients with severe symptoms often are unable to drive, so having an accessible location near public transport or a bus route is important. And appointment availability, so before and after school and work availability. We're also hoping to speed the referral process, so partnering with community healthcare providers to get those concussions in quicker. So in conclusion, the ideal concussion program is a one-stop shop for pre-injury baseline testing all the way through post-injury evaluation and treatment. We want to provide multidisciplinary access in one location, have appointments available within 24 hours of injury, and be a community resource for sports and civic organizations. And this is what we're building at Plymouth Bay, and we hope to offer it completely very, very soon. So thank you.